Hi, my name is Scott, and I had 4 moderately to severely degenerated discs in my neck that were giving me all manner of painful issues throughout my body. In November of 2015, I replaced all 4 with artificial discs in Germany, and the following log is a fairly thorough description of how I arrived at that decision and how things have unfolded. If you're suffering through chronic degenerative disc disease in your neck or in your back as well, but especially in your neck, this story might be particularly interesting to you. What I have done is I've recorded a series of videos throughout the 2 weeks following the surgery, and I've also written up a fairly detailed description of my experience, and I'm going to try to merge them together into a series of videos that I'll put out there for you to view. I'm going to try to be as on track as possible, so to that end I've got a monitor right below the camera that has what I've written out. So my apologies for not looking you in the eyes whenever I'm describing these things. I'm just trying to stay on track. First thing, the legalese. Understand that I'm not a neurologist, an orthopedic surgeon, a chiropractor therapist, or even a witch doctor in training. I'm sharing my own experiences to record this big adventure in my life, mainly to remember it clearly for my own reference, for how things will unfold over time, but also to give others like perhaps you that may be going through the same thing for more information so you can make your own decisions. If at any point I come across as recommending any specific medical courses of actions, just don't listen just to me. Do your own research. That's the big thing. Do your own research and make what are likely going to be serious decisions based upon your own risk tolerances, your own financial situation, and family situation. That said, I do hope that you find value in what I'm going to share and that it helps you in some way, because spinal problems really are a real deal. They're a big deal, as I've come to discover. You're also probably wondering, first and foremost, was it worth it? Am I glad that I had the procedure done? Am I happy I selected artificial discs? Am I happy I selected Dr. Bernatoli and his staff? Am I doing better? And the answer to all of those things is yes. As it is today is 16 days, I believe, post-surgery, and I'm doing really pretty good. I'm home. Got home a couple days ago. I got to experience Thanksgiving with my family. And I'm moving around. I've actually even been able to drive. I was out for about a half an hour yesterday, and I've been walking about 2 to 3 miles a day over the last about a week or week and a half. I am still following doctor's orders, and then there's a whole lot of stuff that I'm not doing on purpose, and that's good. But I feel, and I am still encountering some various different distraction pains that I'll describe later. But overall, I'm doing well. That said, who am I, first and foremost? I'm a 48-year-old information technology architect. I live in Columbus, Ohio. My day job keeps me lightly active, typically in the evenings and weekends. I take care of my home and my college student daughter. I ride and repair motorcycles. I walk the dog, cook, and maintain whatever garden I can and some other hobbies in the outdoor activities. I really do like to be active whenever I can be. And so it drives me crazy when I'm not, and I'm not athletic by any stretch of the imagination, and so when I was encountering my neck issues, it really started to close my world down. I would say that my health overall was just below normal, but made even more so because of my neck issues. I've experienced actually neck and lower back and glute pain and leg pain and knee pain whenever shopping or just basic standing and walking for over 15 years. I often had phantom pains and spasms, especially cracky joints too. But it got a lot worse over the last 10 years and significantly worse over the last 3 years. Most days I experienced pain levels about 7 to 10 in my neck and about 5 out of 10 in my lower back, and random neuropathy throughout my body in the form of tingling and numbness and weakness and spasms. My neck didn't really have full range of motion in any direction, especially to the right, especially the lower right, where I could feel a clunking, I mean, not just crackling, but clunking and grinding, as if like bone on bone, osteophyte grinding, whenever I moved across certain arcs. And in fact, if I moved my head down and look at something, I had to be careful about how I brought it back. I would actually have to take my hand and kind of push gently so that I could get up over the hump of a damaged disc in C6 and 7, it turns out. The tendons in my hands constantly hurt, and the ligaments on either sides of my knees were in constant acute pain. That emotional psychological toll had been really very significant. I've always been a very positive person, very optimistic person, but it put more stress on that positivity than I could ever have imagined. I could be talking with somebody and, one-on-one and be okay. I'd have a general kind of 4 out of 10 level of pain, maybe 5 out of 10. And then I'd shift my body in just the slightest of ways and experience it go up to about a 7 or 8 out of 10. And sitting in restaurants was very painful. Sitting in meetings could be painful. Sitting in the car was very painful. And I learned to ignore it for a really long time, but ultimately I associated interacting with people with pain. So not only am I kind of inherently an introvert to begin with, but I would have pain every time I would talk to somebody for longer than a few minutes. And I would work ways to try to end that conversation so I could go back and just focus on whatever specific positions were more comfortable for me. I made my world smaller, except for the occasional motorcycle trip that I steeled myself up for and usually spent a few days silently recovering from afterwards, as kind of a way to grab freedom without having to be too social whenever the pain came. I got a lot from my hobbies. I get a lot from my hobbies, but even most of them had become too painful for more than 30 to 60 minutes at a time, and so I put most of them on hold. In the course of trying to do something about it, my care providers ruled out brain abnormalities, nerve channel damage, poor blood chemistry, and lots more, leading me to believe that most of my problems were spine-related. And in fact, a neurologist told me, straight out, she said, forget about your back right now, forget about your knees, forget about everything else that you're experiencing. Your neck is the first thing that's causing your symptoms. There may be others, you may have other problems, but your neck is first and foremost something that you're going to have to deal with. Put off surgery as long as you can, but at some point it's not going to fix itself. And in fact, that's the experience that I had as I did even non-operative homeopathic kinds of treatments. And to get to that is that in 2012 I started to see an orthopedic specialist about my lower back, and then the MRIs at the time identified bulged L2, L3 discs with advanced disc height loss as well as mild degenerative loss in L4 and 5. And so I may still have lower back issues. I may still have to deal with those. But again, after conventional therapies like massages, NSAIDs, stretching, physical therapy, my lower back slowly improved in the subsequent 3 years since, and it brought that pain down to a 3 out of 10, which was all right, until I drove 12 hours to the beach and 12 hours back, and it re-aggravated my lumbar discs and brought that back up to 5 out of 10. Now, like I said, I'll probably need to deal with my lower back if my cervical issues, as I continue to recover from my cervical surgery, leaves me still with a lot of pain there, but we'll see. And again, in 2012, it was actually a cervical MRI, because I was still having problems with my neck, that indicated that I had 3 moderately to severely degraded cervical discs and a 4th at the top starting to degenerate. Now, at the time, I was recommended to have a 3-level fusion by an orthopedic surgeon here in Columbus, but I wasn't ready to take that permanent step, knowing that fusions, especially that many fusions in your neck, often don't deliver on the promises, and that a 3-level fusion would remove about 50% of my range of motion in my cervical area, and that it would place even more stress on the adjacent discs above and below. I wanted to let disc replacement technology techniques and FDA approval evolve in the hopes of replacement instead of fusion, and so I waited from 2012 to 2015. So over those next 3 years, my neck pain progressed, and on 8/7/2015, just 2 months ago, I had another MRI and X-ray series done on my neck, and they indicated degenerative disc disease, desiccation, loss of disc height, and herniations. Yeah, all of those. At C3-4, C4-5, C5-6, and C6-7, especially C6-7. Because of the number of discs involved, 4 of them, and the potential risks, as well as the costs and lifestyle implications, I pursued multiple options to make the best decision about how to proceed. Basically, I got a whole bunch of professional second opinions. So a friend of mine, surgeon in Texas, reviewed my images and recommended at least a 2-level fusion. Another surgeon in Germany, who I ended up going to, recommended 4-level artificial disc replacements using the ProDisc C Nova device. I met with the Ohio State University James Center neurosurgeon on 9/9, and he recommended laminoplasty, which basically cuts the vertebrae in the back, opens it up, puts a cadaver disc in there or spacer, and gives more room for your spinal column to move around the bulge. But it wasn't really going to fix my issues. I'll talk about that in a minute. Also, a prominent doctor in Cedars-Sinai in Los Angeles recommended fusion at the base level and 3 artificial disc replacements above it. That's also called a hybrid approach, by the way, to get insurance coverage for the basic operation, but the total costs are estimated to be higher than the all ADR approach in Germany, because the costs of doing this in the United States are higher, and it would have been out of pocket. The insurance company would not have paid for more than just that fusion. So I did a lot of research on the ADR devices themselves, the artificial disc replacements, how they work, the success rates, the studies that the FDA is referring to, the studies that my own insurance company is referring to, just how many people in the United States have experience with them, how many in Europe have experience with them, and again, how the insurance company feels about them, and they generally feel awful about them. That's a whole other discussion about conservatism around the willingness to pay for these. So in the end, why did I choose an artificial disc replacement? When I started talking to people about my neck, it made a lot of sense to either do fusion or replacement, but fusion made less sense to me because most of the people that I talked to who had fusions were mostly satisfied, but they knew that they would need more operations later, or they already had operations in adjacent segments. Another group wanted to be more aggressive with homeopathic remedies like chiropractics and massage and physical therapy, and I tried all of those things, especially massage and chiropractics. And I was I binge watched videos on YouTube for a while of people getting their necks cracked and getting their shoulders massaged and getting their muscles loosened up, and I was so envious because the experience that they were supposedly having was not at all what I was having. I was having chronic issues where, traction, I did traction for a while, where even traction for a period of time was not really giving me even short-term relief, let alone long-term relief. It seemed that the lowest 2 discs in particular were so damaged that homeopathic remedies were just not applicable anymore. A third and very small group had ADRs, and they were very satisfied with the results, unless they were marred by other complications resulting from either systemic infections, accidents, or poor bone health. And what I mean by that is that there were a few people there was one fellow who had Legionnaire's disease, and it ended up infecting his discs, and he ended up having to have fusion after the discs were infected, and had to have them removed. There were a couple other cases where folks had been in accidents after they had their neck worked on, and the accidents had damaged the devices and some other vertebrae and other parts of their body as well. There were a few cases of something called sublimation, where the discs themselves start to sink into or absorbed into the bone of the vertebrae themselves. And those individuals had low bone densities, and none of those things looked like things that were going to be applicable to me, but they were things that I had to process as inputs. I was really surprised that well-reputed neurosurgeon at OSU that I had waited nearly 8 weeks to see. I had waited like 3 or 4 weeks to see his reviewer to just make sure that there wasn't something more conventional that they could do for me before I ended up seeing him 3 weeks later. He recommended laminoplasty, which I briefly described what it was, because it wouldn't have fixed the discs at all, wouldn't have addressed them. It just would have opened up space for the spinal cord for some time, and I'm sure I would have enjoyed some relief of symptoms, but I'm pretty sure that I would have experienced the same limited range of motion and that clicking and that clunking that would have required them to go back in and do more later. So I was frustrated there. In fact, I pursued his opinion because he was listed on MobiC's site, and MobiC is an ADR manufacturer, as a surgeon, but he didn't propose ADRs at all. Perhaps it was because the insurance companies feel that, and that device actually itself, and the research done, they're contraindicated whenever multiple levels are involved. And for me, I have 4, because that is not considered a semi-constrained device. It's considered an unconstrained device. So it would have provided not enough stability for my spinal column. Maybe too much detail, but there you go. He did offer fusion as well, but he understood my concern about it being a permanent direction towards the adjacent disc damage, especially since the rest were already going downhill, and it's a pretty well known consequence that stresses are placed on the adjacent levels once the operative ones are immobilized. And remember, I'm 48, and I still like to have an active lifestyle. I don't want to feel like I'm 88 or 98 yet. And so if I'm going to be continuing to put stresses on my discs, and I fuse 1 or 2, or especially 3 or 4 of them, then you know that the rest of them are going to end up getting damaged over the course of 5 or 10 years. At least that's the way that I felt. And I didn't want to set myself for additional additional fusions. Another option was discectomy alone, but that wouldn't have solved much. Would have likely allowed compression of the radiating nerves that traverse the foramen into my arms and below. The hybrid approach from Cedars-Sinai was very intriguing, actually. And while the LA surgeons are the best in the U.S., I think, they're not really the most experienced in the world, like Dr. Bernattoli, who I ultimately decided on. And my insurance was slow walking approval anyway, even for just one level, let alone the hybrid approach. And I was growing impatient with that and some other contradictory information I was hearing from that center. And my spidey senses just told me to be cautious about that approach. So that was just my own decision. So in essence, after researching this topic pretty extensively, I myself decided to go with a 4-level artificial disc replacement operation in Bogen, Germany with Dr. Rudolf Bernattoli. I had that surgery done just 16 days ago on 11/10 of 2015, November 10, 2015. I knew that this was going to be a very expensive operation, that my insurance company may not pay for all of it or even some of it, and that I would be traveling alone for a number of reasons to a country that I had never visited, using at least some of a language that I didn't know, and met a doctor, to meet a doctor I'd never interacted with directly, and I gave him the opportunity to work right beside my spinal column, inserting devices that U.S. doctors have way less experience with. Sounds pretty crazy, doesn't it? But I didn't think so, given his credentials and experience and surgical approach, patient testimonies. At the time that I had it done, he had done already over 6,000 artificial disc replacements, whereas the folks in the U.S. had done maybe 2,000, or the one with the most experience had done maybe 2,000. So far more experience, and seemed to be a lot more logical and methodical about that approach. So in the last part of this particular video, I just want to describe the cost. I'm not going to say how much it was, but it was a lot, and I needed to figure out how I was going to pay for it. So, and even whether I was going to pay for it at all, right? Because it's something that you trade one value for another. In the end, I decided that at 48, there was a false economy of going with a less expensive insurance-covered fusion or series of fusions, because it would probably cost me more in terms of lifestyle, in terms of options later on. And so I sold a bunch of stocks. I robbed my emergency fund, and I took out a small home equity loan in order to pay for this. And I prepaid ProSpine. They require that you do that, and that's Dr. Bernattoli's group, so that they know you're not going to stiff them for the bill once you return back to a country that they don't have jurisdiction over. I did that, and by the way, I do have some tips on how to do that and how to save some money through the foreign exchange that I'll save for another video. Once I did that and I booked my flight, well, I had already set up the date. I booked my flight. I picked my hotel and travel options, decided to go business class instead of economy class, because although that it was a whole lot more, I knew that coming back I would need to have that comfort for my neck and just to reduce the overall the overall stress of the trip. And I think that was probably a good decision. I'm saying it was probably a good decision right now because I still see the sting on my economical bottom line. I'm sure in 5 or 10 years I'll feel like, yeah, I should have done that, absolutely. So that's basically it. In my next video, I'll start to describe the travel and the operation itself, but that is the first video. If you're interested, keep watching. If not, you probably haven't even made it this far. Thanks, and I hope you have a wonderful day.